Welcome back. So let's talk about Nigeria's healthcare sector and the approach of the government under this administration to tackle the health challenges. And we can talk about the sector-wide approach, which aims to strengthen partnerships, to reform primary healthcare centers, to expand the workforce. But how effective has this sector-wide approach been? Let's talk with the Chairman, House Committee on Health, Mr. Honorable Amos Magaji, who joins us this morning from our Abuja studio. Good morning, Mr. Magaji. Thank you for your time. Thank you for your patience so far. Welcome to the program.
Thank you. Good morning. Thank you for having me.
Let's start with what seems to be very, very important at this point in time. Before we begin to look at matters of workforce, primary health care centers. In fact, I was reading a report not too long ago where experts were attributing the congestion in the secondary and tertiary healthcare institutions to the lack of capacity and the deplorable state of the primary healthcare centers. And members of this administration had indeed assured us right here on this program that the rehabilitation of the primary healthcare centers were being, was recording progress. But that is not the case. What are the findings of your committee of the rehabilitation of the primary healthcare centers, particularly the 8 billion naira deployed by this administration for the rehabilitation?
Thank you very much. I can tell you authoritatively that the primary healthcare in Nigeria, though not where it ought to be, but it's not where it used to be. I've gone around the primary healthcare in the northwest, northeast, and even in the southern part of Nigeria, and then even in the north central. So I can tell you that with the basic healthcare provision fund that was provided to strengthen the primary healthcare sector, it has received a massive support. And then this is supposed to come with contribution from the different state government, and that's why we took it upon ourselves as a committee to go around the country to check the implementation of the basic healthcare provision fund and to ensure that those money that are being budgeted, put for revitalization and strengthening of primary healthcare are being channeled well, and then they are receiving the right attention. Many states we went to, there are states that are doing fantastically well in healthcare. And the issue of manpower, the issue of strengthening the infrastructure in primary healthcare, many are doing quite well, but some are still not doing too well when it comes to the issue of primary healthcare. And I agree with you. To decongest the tertiary and secondary health facility, the primary healthcare must be taken serious if we even want to provide health for Nigerians. The universal health coverage, it's supposed to be achieved by 2030. And then for many parts of this country, we're still, lagging behind. And that's why we took it upon ourselves to see that these money that have been budgeted for health are put where they're supposed to be put, and then we scrutinize them and ensure that those responsible for the execution, for the management of primary health care are put on their toes to do just what they are there to do.
Well, let's break it down now. You say that your committee has embarked on oversight to determine the state that we're not where we are supposed to be, but some progress has been made. The target is to revitalize 17,600 primary healthcare centers in 4 years. During your work of oversight, how many primary healthcare centers out of this 17,600 have been revitalized? Which states are supposed to contribute to the funding pool that have not contributed? Which states are doing well? Which states are not doing well? I'd like you to give us a vivid picture of what exactly is happening in that space.
Okay. In many states that we went, apart from the the basic healthcare provision funds, that some states have also revitalized We went to Bauchi State, we went to Kano State, we went to Katsina State, and we just came back from Akwa Ibom, Uyo, and then Cross River, and went through all from Edo State, all across the southern part of South-South geopolitical zone. And we saw many hospitals. There was an hospital we saw primary health care in Uyo. I can tell you, if you go into that primary health care, you will not believe that that's a primary health care in Nigeria. And I think some of these successful stories that we have in our healthcare system supposed to come out, and then let Nigerians also see that things are happening. I encourage them to come out so that the desire of making sure that our tertiary healthcare are decongested. If people don't know that such project exists in their community, they will not attend. And then we went to a primary health care, I think it's in Port Harcourt, River State. And we saw, immediately we entered there, it was a medical doctor that received us at that facility. And we were impressed because if a medical doctor will man primary health care, that means that will also encourage people to attend to those hospitals. I don't have the statistic right now to look at them, but we are also doing our report to all the states, and I assure you, we are not going to doctor anything. And I told the Commissioner of Health, and where we met the governors, we told them, some of them even begged us to say, whatever you see in our state, give us the report as it is. So we are working on the reports right now to tell them where we saw lapses, where they are doing well, and then, of course, some states are lagging behind when it comes to human resource for health. Meanwhile, some are doing fantastically well. Some states have started recruiting maybe 1,500 health workers across the cadre, across the profession, and then they said in the next 2 or 3 years, they are going to have human resource for health that they know can manage effectively their primary health care center.
All right. Honorable Mogaji, before we wrap up on this, which states are not doing too well? Which states have not contributed to the funding pool, the Basic Healthcare Provision Fund?
Some of the states that we went, what we wanted to see was that, okay, this is the amount federal government is giving. How much have you put in? Some of them came out with the project that they themselves have implemented. Like, you know, in time of the counterpart funding, they brought out some project that they have done, some hospital that they have revitalized. What is it right now? Some state, I can tell you that they have, some of them have, let's say, 200 INEC wards, and they ensure that in each ward there is a primary health care center. Some of them, again, are still going on, you know, like you said earlier, a 4-year program to ensure that all the primary health care are revitalized. Now, another thing is that when we are rating their performance, we're also looking at when they started benefiting from the basic health care provision funds. And we are not only talking about the basic health care provision fund, because if the health care center are revitalized and Nigerians are still finding it difficult to pay for health, we are still not there. So we are not only looking at what they are doing concerning primary health care revitalization, we are also looking at what they are doing in terms of giving health insurance for their people. So we are looking at this together. How many people have you been captured in health insurance? Because if Nigerians cannot afford, and then we're also discouraging out-of-pocket expenses. So it needs to go hand in hand. Revitalization of primary health care and also providing health insurance to Nigerians. So I assure you that by the time our reports are done, I can avail you with a copy of our report as it is so that you will have it. And very soon we are done with the report from some of the areas.
Honorable, I know that you've laid a few things you've been able to observe in your oversight function. You've talked about, even posited Akwa Ibom State as one of the places you highlighted as where you saw some incredible work being done, but you have not been able to tell us the ones that are not doing well. Are you not trying to tell us what it is exactly? It's part of the oversight. The reason we have to know is not because we are trying to indict anyone. It's so that they'll wake up.
One of the reasons why I don't want to say this is that, you see, when we go to a state, we pick some primary health care that have been revitalized. And then we also told them to submit the document, submit to us all that they have done, so that we go and assess some of those primary health care, even when without them being there. So some of them we have received all the state that they have done, but we have not been able to visit some of them. You know, you go to a state capital or some of the local government, and you are able probably to see 2, 3, 4, 5 primary health center. Meanwhile, they said they have done maybe 200 primary health care center. I don't think I will give an accurate assessment if I have just seen 10 out of 200 or 15 out of 150. So what we are saying is that I want, by the time my report, the report of my committee is out, that we know that nobody will question them. So we want to increase the number of primary health care that we have visited, aside the one that when we landed on the set, and mind you, this is the first time that the House is engaging in oversighting the primary health care center. Like when we went to Gombe, we visited like 7 primary health care center, and they said they have done way over 160. And with the ones we have seen, it's not right for me to give my judgment when we have not seen other. So where we are going right now is to start, by the time we have seen all and gather all the data of the primary health care that have been revitalized, we are setting subcommittees that will deal with them in every state.
Okay.
We are sending committee, we say, okay, this committee, you are going to Northeast or Zamfara State and monitor this one. So by the time we are done with this, then our assessment will be credible, our assessment will be efficient. So I don't want to say, oh, this state is not doing well, this state is not doing well, this state is doing well, when we have only seen 10 out of 200 that they say they have done.
Okay, Honorable, I know that health is one of what I call the big 4 in terms of the priority sectors for the 2025 allocation. So you have defense and security, which had almost 5 trillion naira, infrastructure about 4+, and then you have education and health. Haven't seen the ones you have seen so far, although you said there's a lot more to be done in terms of seeing all of them. I want you to help us to walk through what connects the dots in terms of challenges. And I'm moving from, I'll give you entities, infrastructure, for instance, service, the equipment, the personnel, and welfare. What are the challenges that you found that are common to all, and what is a proposal to check it? Because primary health care is the closest to the people.
Yeah. I can assure you that one of the major problems that we are having when it comes to health is the budget reallocation. Up to now, Nigeria has not been able to realize the Abuja declaration. Unfortunately, it was done in Abuja here in Nigeria, where it was agreed, and many nations in Africa were signatory to that agreement, that the budget for health should be nothing less than 15%. And if you look at it critically, the budget for health now is not up to 10% in Nigeria. But for the first time, the component of our budget before had been, the recurrent budget was always taking the chunk of the budget. But right now what we have is that the capital component of the budget has received significant increase. And then in 2022, the budget for health, if you divide it per capita, each Nigerian was to go out with 2,700. As against some of our developed countries that they will have like over $11,000 per capita. So when you look at it, first of all, the budgetary allocation, even though you are looking at it as being big, But when you look at it based on infrastructural decay, the population in the country, you look at it and you realize that the budget for health is still very, very low compared to what other African countries are having now based on their population and the demand in the country. Now, aside the budget for, we now have issue with infrastructure. Like, I've gone through almost all the tertiary healthcare in Nigeria, and I can tell you that we are in a country where sometimes even you go to a teaching hospital, federal medical center, and they don't have a CT scan machine. And medical diagnoses are key to treatment. If you are not able to diagnose properly what is the problem with a patient, treatment, of course, will be erroneous. Now, when you look at it, another problem which is also very major, if I will put it even number one, is the issue of human resource for health. And you can agree with me that Nigeria has become the shop where many nations come to take their health workers. Right now, you go to some hospitals, you may not even find a doctor. Some wards have closed in many of our health facilities because we don't have nurses. And it's not because of anything, it's because of numeration. Most times when you look at the money being paid Nigerian doctors in Nigeria are still earning, maybe from the entry level, medical officers, some of them are getting between 200 and 250,000. As against some countries where a medical officer will earn maybe something between $30-something thousand or so per annum. So these are the major problem. But 2025 budget try to address many of those problems, because once 2025 budget is implemented fully, we are going to have infrastructure in almost all our tertiary health institutions, and then of course the revitalization of the primary health care is also ongoing. So that's why I said in the beginning.
If I may comment, my apologies. I'm happy you mentioned the issue about entry-level doctors and how much they are paid, and this is part of the challenge. Just let's maybe expand the conversation beyond the primary health care. We'll go back to it in just a moment. And the doctors, resident doctors, are now on strike. And this has become a recurrent decimal. I believe that it doesn't matter where it happens, but people like the police, the army, you know, these essential services, especially those in the private sector, should never have to go on strike for whatever reason. But ours looks like it's a normal situation. And when you actually look at how much money is involved in all of this, it's not that much that the state cannot afford. And your committee, as well as that of the Senate, the upper chamber, has a role for checks and balances on the executive. What exactly are you doing as a committee to engage, to see, it's not just ending this particular strike, to end this is it epidemic or strike across different administration?
Thank you. What I discovered on Friday last week, I sat with the leadership of the Association of Resident Doctors, and we have started engaging with them. And this is what I said: whatever you have engaged with the federal government as regarding numeration and salary adjustment or allowances, we want to have a copy, and and my committee is going to be involved in the dispute between the medical workers and the federal government, so that if the government agrees that we are going to increase salary to a certain percent, we want to see it reflected in the budget. You see, over the years, what happens is that agreements are made with be it medical doctors or ASU, and at the end, most times we are not sincere in our dispute resolution. You sit with medical doctor, you sit with ASU, and then because you want them to resume work, you quickly agree with them and say, we are going to pay so amount, we are going to do that. And by the time they call off the strike, they will work for 6 months, 1 year, and those are not met. And I said, if you are going to increase by 5% the salary, know that this is what we are able to do. What you are not going to do, don't lie. Come clean. Okay, medical doctors are asking, okay, treatment allowance, this is what we want. You say, no, we cannot do this. A, B, C, D, we can do. L, Z, we cannot do. We will do this in 2 months. We will do this in 6 months. We will do this after 2 years. This we won't be able to achieve now based on our present reality. And I think if we are sincere with our union, in our dispute resolution, we will not be having all these strikes all the time. And that's why we said, okay, I'm even having a meeting with them today by 3 p.m. And we are going to agree all the demands that the Association of Resident Doctors brought, including those in FCT. I have them with me. And we are going to look at it, the agreement, which one is going to be done now, which one is going to be done next year, which one is the federal government said they are not going to do, and when will you do it? And then with the House, we'll put the federal government, especially the Ministry of Health, and all the bodies that are responsible in check to ensure that whatever they have agreed with the union is being implemented. We'll sit down now. If you say you're increasing the salary, we are going to see it reflected in the budget that you are presenting. And if it's not reflecting, we know what to do. And I'll assure you that this time around, we'll ensure that whatsoever agreement is made, the House is going to be involved in the dispute resolution with all the unions in health sector.
And we hope that the House will also be advocating strongly a decent remuneration for the health workers in the health sector across board, not just for doctors, because of the big concern about the brain drain. Honorable Magaji, permit me to go back to where I started from, and it's for good reason, because when you highlighted the states that are doing well, you mentioned names, and I recall you mentioned Akwa Ibom, you mentioned Cross River, you mentioned some northern states too, Katsina, Kano, I believe. But when asked to mention states that are not doing well, you shied away from doing so. And this is important for us to know in the spirit of accountability. And I'm following up on this because you see that in states, the subnationals are commissioning impressive medical centers, pediatric centers, diagnostic centers. The Minister of Health only a few weeks ago went across a number of states to commission some projects. So the states are investing in state-of-the-art medical centers. But why are they not doing the same for the rehabilitation of primary health care centers, which is the first responder as far as healthcare is concerned, especially to the people at the rural areas. So what are you finding out in terms of comparative deployment of allocations to budget by the subnationals, such that we can understand what exactly is happening in our primary health care center? This is critical.
Okay, let me be clear with this. I assure you that I'm going to submit the report. I'm going to make the report public. Now, for example, I go to Kano and I say, with the level of insecurity, it's not every primary care center we will be able to access. We are using different avenues. We are using our colleagues in their local government. And therefore, we are receiving all the submissions. The primary health care that have been revitalized. If a primary health care is revitalized in, let's say, Agege, I know the member representing Agege. If we cannot reach there, if the primary health care is revitalized in Brass, for example, in Bayelsa State, if the committee is not able to reach there, we have members in the House. There is no state in this federation that I don't have a member in my committee. So we are trying to, now some of them, when we went to the state, we say we want to see this. Some of them said they started revitalizing the primary health care from the interior, not from the state capital. And therefore, that's what I'm saying. I want to see before I make my own comment. Not that I'm running away from that question, no. But I want to say, he that accused should also be ready to prove what he's accusing. So I want to really see it first, assess them based on the amount. What we told them to do was, okay, tell us the primary center you have revitalized, the amount you have spent revitalizing it, and then also submit to us the amount so far received. We know the amount from the federal government that will be allocated to your state. We also want you to agree with us that this is the amount you have received. And we want to know, okay, this amount received, we have deployed it to so hospital. Then we check it. Like, for example, if you say now that, okay, there's a hospital in Birningwari in Kaduna, and then you revitalize hospital in Birningwari, and you say there's hospital that have been revitalized in Chafe in Zamfara State. I haven't gone there before I assess it. So I want to see, especially not the state capital. You see, looking at the hospital in state capital can be deceptive.
All right.
The state capital most time are not even the hospitals area that need the primary health care center more. Because many of our tertiary and secondary facilities are in the capital. We want to know what is there in some of the interior local government in some of the states. And that's why I'm saying until we go there, do our investigation, we're going to send our team quietly to go and make assessment before we give you.
We must anchor the conversation at this time, and we look forward to the report that you have promised to make public.
I assure you, I will make it available to you.
All right. Yeah. Honorable Amos Magaji is the Chairman, House Committee on Health, and he has joined us on this conversation from our Abuja studio. Thank you so much for your time on the program.
Thank you for having me.
We'll take a moment now. When we return, it will be time to continue on our conversation on that very important topic, the allegations of Christian genocidal killings against Christians in Nigeria. What are the implications? Stay with us. We'll be right back.